Laprade Show continues on City News.
101.1 FM and 1310 AM.
Well, I promised that the doctor would be in the house, and we have Dr. Paul MacPherson with us. Hi, Doctor.
Hi there, how are you?
Happy Pride.
Yeah, same to you.
Dr. MacPherson is a physician scientist in the chronic disease program at the Ottawa Hospital and also very involved in the gay men's health chair. You and I have spoke before. I'm fascinated by this at the Ottawa Hospital, that there be such an interest taken in gay men's health. It's a really good opportunity to talk about this, of course, during Pride Week. Walk us through a little bit about this important program.
Well, I'm really delighted to say the Ottawa Hospital has taken such an interest and really supportive of sexual minority health. Establishing this chair really will be one of the first in Canada to have a research chair within an academic institution. So we're very excited about this. We really intend to become a leader in this area, not just for Eastern Ontario, but for Ontario itself and perhaps even nationally. So I'm happy to say, since we last talked, our fundraising has been quite successful, and we are about to launch the chair. So we'll be recruiting someone into this position to help advance delivery of healthcare to gay men, and recruited through the Ottawa Hospital and the Ottawa Hospital Research Institute. We are still fundraising for the chair. For the moment, this will be a term chair, meaning we have enough money probably to have someone in this position for somewhere in the order of 5 to 7 years. Our hope, though, is to convert this into an endowed chair, meaning the chair would continue on indefinitely, with different people filling that role over time. So we're continuing to fundraise to help extend the life of that chair.
I think it's such an important topic, Dr. MacPherson, because I think no matter who you are, it's a little bit daunting to maybe have a conversation about your sexuality with your doctor. And you've shared with me before that it's even more challenging for gay men.
Yeah, so this is one of the things we've discovered in our work here. There's just a couple, roadblocks or barriers when it comes to delivering care to gay men, and that falls on both sides of the equation. So, in the focus groups we've done with gay men, as you mentioned, are really quite, in general, not everyone, but in general, gay men are wary of the healthcare system and of healthcare providers. They worry about being discriminated against or judged or even just stereotyped when they bring up their sexuality. And that bears out in the studies we've done, particularly here in Ottawa, where we found 24% of gay men do not disclose their sexual orientation to their primary care provider. And that actually goes up to 40% when we look at men living outside the urban core, so men living in smaller towns around Ottawa, and it actually jumps to 80% who don't disclose their sexual orientation among bisexual men. So, this is a problem in trying to deliver care to men if they're, not willing to disclose. And part of that also is men do sense kind of a lack of awareness or knowledge around gay men's health issues from many healthcare providers, which kind of accentuates that. But on the other side of the equation are us, the healthcare providers, and many healthcare providers do feel poorly equipped to deliver healthcare to sexual minorities. When you look at med schools, and that's a daunting task to try and educate people in medicine over just 4 years. So it is difficult to get everything in, but we find only a couple of hours are spent over the entire 4 years on sexual minority health. So physicians, nurse practitioners out there do feel like their knowledge is not really where they would like it to be in order to provide the care they want to provide to gay men when they come to them.
Who decided that this was a real priority for the Ottawa Hospital? Does this come from leadership?
I think it just came from a lot of work that's been done. The idea for the chair itself came from the community, I'm happy to say. We had one gentleman in particular who simply asked the question, why do we not have a research chair to explore these issues more? And, he took that forward and presented it to leadership, and they heard that need and responded very positively.
And I think that's just another example of the Ottawa Hospital being a world-class organization. I think, in a city of 1 million people, we're very, very blessed to have the Ottawa Hospital and talented physicians like yourself. Dr. MacPherson, when you think about all of the issues a gay man would be challenged with regarding their health, what comes to mind?
Oh, it's just covers all areas, and we've tried to focus on both physical health, mental health, social health, sexual health. Mental health plays a big role. Again, in our studies, we found just among the gay men in Ottawa, 14% score in a validated screening tool as having depression and 19% as having anxiety. There's also almost 1 in 3 gay men have suffered physical abuse from within their family. So there's a big mental health component here. Physical health as well, though, many healthcare providers aren't aware of different preventative health measures that should be addressed when it comes to gay men. And there's a whole sexual health component, of course, as well, and there's also a lot of misinformation within the healthcare system about what sex between men is really like. And that leads to perpetuation of misinformation provided to patients when they present with complaints. So I think it covers the whole gamut of health.
It's so important, I think. I'm so glad you sort of walked us through the different components. And mental health, it's been challenging for so many people throughout this. But I do specifically and have thought about, as an ally, about the gay community at this time. What are you hearing from people in your community?
Yeah, well, it can be tough. Everybody has different circumstances, and when it comes to any sexual minority, of course, there's as many different situations as there are for any others. But certainly within my clinical experience, one of the things across the pandemic, of course, is a lot of gay men were very isolated. So, like anyone living at home and then sent to work at home, if they're living alone, they're working at home alone, they have no ability to connect them with the community. Bars are closed, community organizations are closed, and so there was a great deal of isolation happening among gay men, which really did tax mental health quite severely.
And what does Pride Week mean to you, Dr. MacPherson?
I think Pride Week for me is always just a celebration of diversity, and it's not just about sexual minorities, of being gay or bisexual or trans. I think it's really about diversity in all its colors of the rainbow flag, and being proud of who we are, but also, and it's not just acceptance; it's really welcoming people for their diversity.
And, as I think about Pride Week and the opportunities that I've had to speak to you over a number of years, I often think that I'm hoping that the model you're creating here for a gay men's health chair will be taken across the country and eventually across the globe.
We hope so too, and we hope it's not just. We hope this model for gay men is also emulated for lesbians, for trans, and for other minorities, not just sexual minorities. We have lots of immigrants coming into Canada who have particular health needs or social determinants of health that need to be addressed. So we hope this kind of approach can be taken up for many minority populations.
Well, thank you so much for spending time with us here on City News. It's always a pleasure to share some time with you, talk about Pride, of course, and talk about the Gay Men's Health Chair. Thank you so much.
Oh, thank you, Sam.
My pleasure. Dr. Paul MacPherson, physician and scientist in the chronic disease program at the Ottawa Hospital. Fascinating there to see what's being done in Ottawa. And we hope that you're having an opportunity this week to celebrate Pride.